Hello pharmacists. Welcome to yet another lesson with Purple Pharmy. Today, let us learn or remind ourselves what are the main questions to be covered during a pharmacist consult for vaginal thrush treatment. Here is a case study of a 28-year-old woman asking for something for itching and a thick white discharge, like cottage cheese. Her colleague recommended her to go to her local pharmacist to get the medicine for vaginal thrush. How will you handle this scenario? You pharmacists. While Fluconazole 150 mg stat dose is a regular way of treating the condition. Ask her these 5 important questions to figure out the condition and recommend the correct medicine. The first question is, what is your age or DOB? It is generally not recommended to supply Fluconazole in children under 18 years due to diagnostic uncertainty. In these vulnerable age groups, symptoms may mimic or mask more serious underlying conditions. For example, possible sexually transmitted infections, STIs, sexual abuse concerns if prepubertal, hormonal changes or poor hygiene rather than thrush. Similarly, in elder patients over 60 years, possible atrophic vaginitis or estrogen deficiency, diabetes, malignancy, or other systemic disease, increased risk of drug interactions or contraindications. Hence, pharmacists must refer these age groups to a doctor for proper diagnosis before treatment. The second question is if the patient have had thrush before. Recurrent vulvovaginal candidiasis equal to or greater than 4 confirmed episodes in the last 12 months is a red flag. Explaining why this matters and how this signals underlying causes: poorly controlled diabetes, immunosuppression cases like HIV, long-term steroid use, antibiotic overuse, tight synthetic clothing or poor ventilation, hormonal contraception or pregnancy, reinfection from sexual partner in rare cases. Pharmacist response: since you've had thrush several times this year, you should see your doctor for further investigation. Sometimes, this can happen if blood sugar is high or if another infection is present. Your doctor might give you a longer antifungal course, 1 capsule weekly for a few months to stop it from coming back. The third question is to confirm if any chances of pregnancy and breastfeeding. The key rule is oral Fluconazole is not recommended in pregnancy. So the standard response is, in pregnancy, we don't recommend the oral capsule because of safety concerns. The best option is a topical antifungal cream or pessary for 6 days. Apply it gently before bedtime, and symptoms should improve in a few days. Similarly, the standard response in breastfeeding is, if you're breastfeeding and have contracted a vaginal thrush, topical creams are the safest. Listing down the fourth question: what are the symptoms of the patient? Let us learn a mnemonic to remember this: SIRBUS. Swelling, itching, redness, burning, unusual discharge, soreness. Thrush is not a sexually transmitted disease or a serious condition, and in most cases it can be treated easily and effectively. It is also normal and very common, and may not caused by a lack of hygiene. The patient might feel pain during sex. However, if the patient has painful sores, blisters, crusts, refer for possible herpes or a STI. The last question to pop is asking the patient if they are on any regular medication. Since Fluconazole 150 mg is usually given stat in vaginal thrush treatment, we should ask the patient of their regular medications, as Fluconazole is a potent CYP enzyme inhibitor. It slows down the metabolism of many drugs. For example, even a single 150 mg dose can affect sensitive patients taking warfarin, increasing INR and bleeding risks. Advise GP monitoring or avoid supply without prescriber approval. Another combination to be avoided is with phenytoin due to toxicity risk. Similarly, carbamazepine as well. However, statins, glipizide, benzodiazepines, OCPs etc. should be reviewed if there are repeated courses. Well pharmacists, wishing you all the best in applying these insights. Please feel free to ask your questions or provide suggestions in the comments section. Happy learning. Hope this helps. Thank you from Purple Pharmy.